First, I would like to welcome Paul Jensen up, who's from AWARE and the Shark Foundation.
Hi, thank you. So, spanning generations, acknowledgement of the land is a traditional custom of Indigenous people when welcoming outsiders onto their land and into their homes. To build respectful relationships, acknowledging the land is an important part of reconciliation. It honors the authentic history of North America, its original people, and tells the story of the creation of this country and that it has historically been missing. In the spirit of respect, reciprocity, and truth, we honor and acknowledge Mohkinstsis and the Treaty 7 territory and oral practices of the Blackfoot Confederacy, Siksika, Kainai, Piikani, as well as the Stoney Nakoda and Tsuut'ina nations. We acknowledge that this territory is home to the Métis Nation of Alberta Region 3, within the historical Northwest Métis homeland. Finally, we acknowledge all nations, Indigenous and non, who live, work, and play on this land and who honor and celebrate this territory. Thank you all.
Amazing. Thank you, Paul. And now I'd like to welcome up Avnish Nanda, who is the lawyer responsible for bringing this claim forward.
Hi, my name is Avnish Nanda, and I am the lawyer for Mom Stop the Harm and the Lethbridge Overdose Prevention Society in their claim against the Alberta Government for restrictions placed on supervised consumption access in Alberta. In April of this year, the government passed a number of measures that will impact the delivery of supervised consumption services in this province. We are moving from a model of delivery that's based on anonymity and confidentiality to one where anytime anyone accesses safe consumption services in this province, they have to give personal identifying information. Information such as their personal health care number, their full name, their details, and that information can be shared with other healthcare providers, even police agencies, without the consent of substance users. And as folks can imagine, that creates a major barrier for folks willing to access supervised consumption sites. It's going to lead folks to no longer receive these services, consume substances in unsafe manners, increasing the risk of overdose and other harms, and perhaps even death. In addition, the new restrictions prevent overdose prevention societies or service providers from operating. Overdose prevention societies or service providers are critical to addressing this epidemic. These are small, grassroots, usually peer-led collectives and organizations that assist folks who are using substances to do so in a safe way. And these new restrictions effectively prohibit them from operating, which is contrary to what the federal government has done in recent years, which is identify overdose prevention societies as being critical to addressing this epidemic. As a result of these changes, Mom Stop the Harm and Lethbridge Overdose Prevention Society has commenced a lawsuit against the Alberta Government, taking the position that these restrictions violate the charter rights of not just substance users, but of overdose prevention societies, and they undermine the federal government's exclusive authority over authorizing supervised consumption services in Canada. Thank you so much.
Okay, thank you. And now I'd like to invite Kim Porter from Mom Stop the Harm.
Good afternoon. My name is Kim Porter, and I'm here today representing Mom Stop the Harm. Petra Schultz and I, along with the Lethbridge Overdose Prevention Society, are plaintiffs in this case. Petra and I forever mourn for the loss of our sons. Our children would not have died if they had had access to supervised consumption sites. This support was not available to them, and so they died alone with the shame and stigma our society and out-of-date drug policies put upon them. We advocate out of a sense of hope However, if people are not kept alive, neither is our hope for a better tomorrow and for lives saved. As members of Mum Stop the Harm, we strongly oppose the new provincial recovery guidelines. These guidelines create barriers that will keep people from life-saving services. Many people using a supervised consumption site already feel marginalized and judged. By imposing the new criteria of having to produce a personal health number, of which some will not have, and by being unsure what this personal information will be used for, many have said they will refuse to use these sites, thus leading to the very real possibility of using alone, overdosing, and dying. A just community would not allow this. These are not guidelines, these are restrictions to life. By launching this lawsuit, together with Lethbridge Overdose Prevention Society, we hope to help save families from planning funerals that need not happen. We hope to save lives and to give people hope for the future. Thank you.
Thank you, Kim. And now I'd like to welcome up Yoon Thompson from Each and Every Businesses for Harm Reduction.
Hi, my name is Ewan Thompson with Each and Every Businesses for Harm Reduction, a coalition of 150 businesses across Canada, including over 100 here in Alberta, that are standing up for harm reduction measures like supervised consumption sites to reverse the drug poisoning crisis. These are businesses that understand their obligation to truth and reconciliation, that understand that when we're seeing First Nations people die at 7 times the rate of non-First Nations people from drug poisonings, that this is completely unacceptable and represents a complete failing of our society in addressing a major problem. Businesses that understand that every community member is deserving of acknowledgement, respect, acceptance, and support. Businesses that understand that supervised consumption sites don't impact safety in our communities. There's never been a peer-reviewed study that's shown that anywhere. And that 14-year-olds should not be responding to overdoses on the streets. And when we start seeing that, things have gone way too far already. That drugs and drug use and the use of mood-altering substances is not a moral failing, it's a completely normal human activity that we all do. That businesses that understand that listening to people who use drugs, people that are on the front lines of this crisis, that aren't experiencing the crisis from the Sky Palace, are the ones we should be listening to first. That they know best. That these are the people that have already been surviving this crisis for decades and understand how to get through it. And last of all, these are businesses that understand that this is a working age crisis. These are people from 15 to 60 that are most impacted. I spoke with a construction association representative who told me that the number of crews that they have in their association that had not lost somebody to overdose was now in the minority. Premier Kenney, if you want to support the trades, maybe we should start by keeping them alive. Premier Kenney, Associate Minister Ellis, Minister Luan, businesses do not stand with you on this issue. You have it wrong. For every single business in this downtown core that you can point to that will stand up and openly in public acknowledge their opposition to the supervised consumption site here, I can point you to 30 that'll say the exact opposite. Not only should we be maintaining safe works and maintaining low barrier access to it, we should be building more. Each and Every is proud to support this necessary action, and we applaud Mr. Nanda, Lethbridge Overdose Prevention Society, and Mom Stop the Harm for taking this necessary step. And thank you very much.
Thank you, Ewan. Now I'd like to invite Dr. Kate Bisbee, who is a family physician who has worked with the community for over a decade.
Good afternoon. I just want to start by saying, oh, louder, how full my heart is to see so many people here today showing up. Please keep showing up. It gives us all the strength to keep up the fight. Okay, I'll just tiptoe, that's fine. I want to say thank you for the honor of speaking today in support of this lawsuit. As mentioned, I'm a family doc. I've worked for coming up on 11 years in Calgary with this population. I echo the concerns already raised, and I fully support this lawsuit. I am here today because I have lost patients to unintentional opioid poisonings. The UCP's changes create unnecessary and harmful barriers to Albertans accessing life-saving, evidence-based, best practice medical care. Fewer people will be able to access these sites, and more people will die. I'm also here today because I've seen patients become healthier and recover with support from overdose prevention sites. Overdose prevention sites connect people with recovery services. They do not block recovery, they are part of recovery. Without access to overdose prevention sites, fewer people will recover. If the UCP's aim is recovery, as they claim, they are going about this entirely wrong. I am also here today as a community member. I work and play in this community. I live 10 minutes that way. I know that overdose prevention sites keep our communities safer. I demand that the UCP do their job to keep us all safer. Lastly, I am here today because people who use overdose prevention sites are more likely than not marginalized by racism, poverty, mental illness, childhood abuse, and other traumas. A just and moral society does not treat survivors like this. I call on Minister Mike Ellis to stop these changes. You do not have to inherit Jason Luan's harmful legacy. The choice is yours. To my fellow Albertans, I beg you to speak up for our loved ones who use drugs. They are your friends, they are your coworkers, they are your family. They are human beings. Please write, call, email your MLA, Minister Ellis and Jason Kenney. Demand access to these life-saving overdose prevention sites. And lastly, and in my opinion most importantly, to people who use drugs, please know your lives matter. We are here today to fight with you, for you. Thank you.
Thank you so much, Dr. Kate Bisbee. And I'd now like to invite Ophelia, who is a current client of the Safe Consumption site.
I'm a little short, sorry. All right, so my name is Ophelia, and I'm an intravenous drug user. I take about 4 shots of usually Dilaudid every single day. But with the help of the SCS, I have actually been able to balance my intravenous drug use with the rest of my life. It is thanks to these overdose prevention services that I am able to live a happy, functioning life where I have friends, I have my education, and I have family. I have really everything that I could want, even though I do still use intravenous drugs. And when I was reading the new regulations that were released for overdose prevention sites, one thing was abundantly clear to me. People who use drugs were not consulted, because when you're using drugs, there's certain things that you learn that you otherwise don't know unless you're part of that group. Now, the reason that that is important is because drugs are kind of a hard topic to talk about. I mean, when you're younger, there's dirty words like curses, but as an adult, the only words that are really dirty words are drugs. I mean, if you say heroin, you can pretty much silence a room, because that is one of the last remaining dirty words. And I know that it's a hard and uncomfortable topic to discuss, but with people who inject drugs not being consulted for the new regulations for the safe site, this means that there is now barriers to people accessing that service. As was mentioned, with personal health numbers now being required, many people who use drugs do not have personal identification cards, or do not have healthcare numbers, or have no way to prove what their healthcare number is. So this creates a very, very direct block to an estimated 60 to 70% of the people who use the safe site right now. And without having those safe spaces to know that if you overdose, you're going to be taken care of, that is going to lead to a massive increase in overdose deaths. Because even if the site isn't going to be closed outright, to that 70% of people, it essentially is. Now, along with that, the recovery-oriented care, as the government has stated, also has the potential to cause some harm. The reason that I say this is because, first of all, the plan is to relocate the safe site to an affiliated third-party organization. Now, to me, what that means is that the affiliated third-party organization will most likely be one that already helps people to quit drugs and get sober. Now, this is a problem because with the SCS being a nonprofit service and generally detox, rehab, things like that being somewhat for-profit, this creates a vested interest with the people who work there to push for sobriety. And additionally, the new safe site guidelines have also stated that there needs to be a record of what recovery services were clients referred to, and how were they given more resources in order to get sober. But this is going to create an environment where conversations about needing to get sober become a lot more common. And this is going to also allow for the possibility of more judgment, more discrimination, and more ridicule for people who have no intention of getting sober. For instance, I have absolutely no intention of getting sober. I reduce the harm from my use as much as I possibly can, and I live a very, very good life now, but I have no intention of getting sober. And the safe site right now provides something of a safe haven for me, because when I have been to the hospital or other healthcare services, I have experienced a lot of very, very harsh treatment. I'll give you some examples of this. When I had one of my overdoses, and I was taken to the hospital after, and one of the nurses at the hospital, she said to me, "You know, you should make sure that no one naloxones you next time so you stop wasting resources. Then another time, I had tried to get sober for a few months. At this point, I had been off drugs for 4 months, no alcohol even, nothing. And I needed to go get blood taken because, it's good to get occasional testing done to make sure you're healthy. So I went in and I told the nurse who was doing it that I haven't had a needle ever since I've quit using IV drugs, and this is going to be really hard for me. I understand that it's important that I do this and I want to do this, but just please be mindful that this will be difficult for me. When the nurse brings out the tourniquet, I started crying because that was a very emotional and difficult thing for me to see again. And once she had the needle in my arm, she asked me if I missed doing drugs. Then when I was leaving, she told me that the clinic will call me and let me know which STDs I'm positive for, just assuming that I would definitely be positive for something. I wasn't, for the record. She also told me to take an naloxone kit because you're going to relapse. People like you always do. And I'd been 4 months sober at this point. I did relapse, but I am unbelievably glad that I did, because for me, I felt better in the past 3 months than I ever have before in my life. I sleep well, I eat well, I feel good about myself, I know what I want to do with my future, and I feel very, very good. But being told that I'm for sure going to relapse because people like me always do, when I was trying to stay sober, was a very, very disheartening thing to hear. Now, my worst story of healthcare providers having biases, and we all have biases, that's absolutely understandable. But my worst story was actually my last ever overdose in December. I overdosed at my mom's house, and she called paramedics, who also sent police officers with them. So when I came to, they said I need to go to the hospital, even though there's no evidence that you need any further care after receiving naloxone. No person who's overdosed and received naloxone has died because of not receiving more medical care. But I explained to them that, I need a minute to just think and kind of process this because, I just overdosed and hospitals absolutely terrify me. I guess they didn't want to give me a minute because the police officer grabbed me by my upper arm, dragged me to my feet. I had a bruise on my arm for about a week after that. And then I said, okay, fine, I'll cooperate. But I guess that wasn't good enough because they slammed me face down onto my bed, handcuffed me, and then gave me a shot of benzodiazepines in my ass. So I couldn't even walk properly, and they kind of just pushed/dragged me down the stairs out in front of all of my neighbors into the ambulance, where they continued to restrain me and then told me that I would be dead by the time I'm 20, and that's probably for the best. So if you ask most drug users or most former drug users, all of them can tell you similar stories to these ones. There is a very, very fractured relationship between drug users and healthcare providers. But since I started visiting the SCS, that has been repairing my trust in healthcare workers. Because at the SCS, they meet you where you are at. That is the most important thing to do, meet someone where they are at. If they want to get sober, then help them with that, absolutely. If they want to reduce the harm they're doing to themselves with their drug use, then help them. But don't try to make the decision for someone else what they should be doing about their drug problem. Meet them where they are at. That is the most important thing to do. And with the SCS being changed to be a recovery-oriented service, I feel like that also is going to change. I feel like there's going to be more pressure to go to detox, more pressure to get sober, even though that doesn't necessarily work for everyone, and even though maybe someone isn't there yet. Maybe one day they will be, but you can't get sober for someone else. If you're going to get sober, it has to be for yourself, and it has to be completely your decision. And you shouldn't be forced into it by anyone else. Additionally, the evidence has shown that meeting people where they are at, giving them non-judgmental overdose prevention sites where they don't have to worry about fielding questions about getting sober or being pressured or being ridiculed, which is something that blatantly happens in all other areas of healthcare, but also having access to safe supply, for example. The evidence has shown that those methods of handling the opioid overdose crisis have been the most effective. Or treating the opioid overdose crisis with the IOT program, which has now been closed, so no one new can join. But the IOT program was one of the most successful treatments for a drug problem because it allows you to replace heroin and fentanyl with hydromorphone, a safe pharmaceutical quality hydromorphone. And even though the evidence is showing that these are the most effective ways to approach our drug problem, the government seems to still take them out of healthcare. I don't think that politics should have any place in healthcare. Even if it's difficult for people to stomach, I think we need to go with what the evidence says will actually work for helping people get better, even if it's not the easiest for us to deal with mentally. So I think since the new guidelines have rendered the safe site inaccessible for its primary demographic and have also rendered it a less safe place, I think that the government should redo these regulations and actually consult people who use drugs. Actually consult us. We are happy to talk to you about what we need and why we need it, but unless you have been there, unless you have lived it, you don't know what it's like. I had no idea until I actually started experiencing this stuff. And it's so important that the demographic that these changes concern be involved in the making of decisions. That is so, so important. I cannot overstate how important that is. We need to keep the safe site safe for the people who need it, and we need to keep it accessible. Thank you.
Thank you so much, Ophelia. Now we're going to open the floor to questions. So I'd like to invite all of our speakers back up, and then we can keep this rolling.
Yeah, it's a brief whatever questions you may have. Well, experts, substance users, everyone who's involved in this seems to say the opposite. And the only person saying or source saying that this is not an issue is the government. So the government's been wrong every single time when it's come to its harm reduction policies, and it just needs to do the right thing this time. So many people will be affected by this. Well, it's the community here, right? It's everyone coming together. It's not just me or one person or a lawyer. It's this community that's come together all across this province and are willing to do whatever it takes to stop this government from destroying lives, destroying communities. And folks in this community are at a line, at the edge here. This government has done so much to undermine everything, to put them at risk, and it's, we don't bring these lawsuits for fun. This is real sense of urgency here. The the Government of Canada's lawyers have been in touch with me, and they've indicated that they may participate later on in the proceeding if they think it's necessary. Any more questions? Okay. Sure. Alex.
Thanks so much for speaking. That's awesome.
So yeah, if there's no more questions, then thank you for coming. We'll wrap this up, and thank you to all of our speakers and everyone who came to show your support and just say yes to SCS. Thank you.